A major health campaign has been running in the UAE this year, designed to shed light on the importance of getting your heart checked for heart failure and other cardiovascular issues. Doctors are urging people to be aware of the early signs of heart failure, advising members of the public that early intervention can save lives. I spoke with Dr. Jawera Al-Ali, a board member of the World Heart Federation and the president of the Emirates Cardiac Society, to ask how successful the campaign had been so far.
Seen incredible feedback from people. This campaign has been divided into TV interviews, social network posts, and some educational events in different hospitals around the UAE. And during these events, they have been screening for risk factors for cardiovascular disease. And we have been directing people to seek medical help if we find any of these risk factors, because it's very important to treat the risk when we find it. And we found that people are very receptive and people are really interested in screening for cardiovascular disease.
So tell me, what are some of the warning symptoms to look out for? How do we know the difference between being a bit tired, a bit out of breath, and it's time to see the doctor?
So when I talk to my patients, what I tell them is, if you are someone who's active and who exercises regularly, and now you notice a significant difference in what you do, then this is the first sign of heart disease. Okay. So if you're exercising for 20 minutes or 30 minutes regularly, and now you cannot do 10 minutes, you need to see a doctor. Mm-hmm. The other thing is any new onset of shortness of breath. So if you're short of breath, but you didn't used to be, you're unable to lie flat on your bed, you notice new swelling in your legs. These are all signs that there is heart disease happening and you need to see a doctor.
Mm-hmm. Tell me, what are some of the things we can try and do to lower our risk of heart failure and other cardiovascular diseases?
So it's very important to screen for the risk factors and to treat them very well. So one of the major risk factors is physical inactivity. And now the weather is starting to get nicer, so it's a good chance to go out there and start exercising, because that's very important. Exercising by itself, 30 minutes a day, where you risk, even if you don't lose weight. So the target is not to lose weight, but to exercise and get your body moving. Having a healthy diet is very important. Lots of vegetables and fruit, and less of processed food. That can keep your heart healthy. And then maintaining a healthy weight. Stopping smoking, of course. Smoking is very well known to cause heart disease, so it's very important to stop that. And then managing your stress in your life. So that's tricky, because whenever you tell someone life is stressful, but it's very important to find ways to manage your stress. Exercise can be a way to manage stress, but also social interactions, speaking to your friends, trying to have breaks in your work. Because stress can impact your heart very negatively.
Absolutely. I think trying to add some more of that incidental exercise into your day as well, I think, is so important. So tell me, we're obviously trying to get people excited about going to the doctor, etc., but we know that in this part of the world, we often see heart issues about a decade earlier than other parts of the world. So are there particular ages we should start visiting the doctor to get a heart checkup, or does it go further than just age factors?
So, I mean, the international recommendation is to start at age 40. But since we have heart disease at a younger age in this population, it's very important to start at least at the beginning of adulthood. So at the age of 18, 17 or 18, to start to have a baseline checkup. And once you have the baseline checkup, the doctor will be able to tell you how frequent you need to do that. So if there was something that was picked during the baseline checkup, then you will have to do it more frequently to make sure that there is progress and you're not heading towards the wrong direction. Mm-hmm. If everything was fine, then probably at the age of 18 to screen again after 5 years is fine. But if there was an issue, then you need to be screened earlier at 6 months or at a year, depending on what the issue was.